This video is about engagement, synclitism and asynclitism. Now let's start. The mechanism by which the biparietal diameter, the greatest transverse diameter of the fetal head in an occiput presentations passes through the pelvic inlet. This is the pelvic inlet, is known as engagement. Normal synclitism is when a biparietal diameter or transverse diameter of the fetal head, this is the transverse diameter of the fetal head, is parallel to the plane of the pelvis of mother. Although the fetal head tends to accommodate to the transverse axis of the pelvic inlet, the sagittal suture, while remaining parallel to that axis, may not be exactly midway between pelvis symphysis and sacral promontory. Instead, it is either deflected towards the posterior side, that is towards the sacral promontory, or towards the anterior side, that is towards the pubic symphysis. Such deflection of the head is known as asynclitism. Asynclitism is of two types: anterior asynclitism, which is also known as anterior parietal presentations, or posterior asynclitism, which is also known as posterior parietal presentation. You might be thinking that how parietal presentations can be either anterior or posterior. Okay, then I will clear this before proceeding further. As we are discussing in relation to the mother pelvis as said earlier, so let's see in this picture. Let's assume this is the parietal bone and there is sagittal sutures in between. Now, parietal bone, which is towards the anterior side, that is towards the pubic symphysis, is known as anterior parietal, and the parietal bone which is towards the posterior side, that is towards the sacral promontory, is known as posterior parietal. Anterior asynclitism: when the sagittal suture lies posteriorly towards the sacral promontory, then more of the anterior parietal bone presents itself to the examining figure, or we can say that anterior parietal presentation is the leading presenting part. Thus, it is known as anterior asynclitism or anterior parietal presentation. Posterior asynclitism: when the sagittal suture lies more anteriorly towards the pubic symphysis, then more of the posterior parietal bone presents itself to the examining figure, or we can say that posterior parietal presentation is the leading presenting part, and it is known as posterior asynclitism or posterior parietal presentation. In case if you get confused or forget, then just remember A for A and P for P. That is, in anterior asynclitism, anterior parietal bone presents first, and in posterior asynclitism, posterior parietal bone presents first. Hope this video is useful for you guys. Please like, share and subscribe.